Now we are going to see about the right ventricle. So we have seen this is right atrium, this is right ventricle. This contributes to sternocostal surface of the heart as well as right 1/3 of the diaphragmatic surface of the heart. Anteriorly in the sternocostal surface, right ventricle is separated from right atrium by anterior part of the coronary sulcus, lodging the right coronary artery and the small cardiac vein. It is separated from the left ventricle by anterior interventricular sulcus, which will be lodging anterior interventricular artery and great cardiac vein. This also contributes to the inferior border of the heart. Middle 2/3 of the inferior border of the heart, right 1/3 by right atrium, left 1/3 by the left ventricle and apex. Now we will move into the interior of the right ventricle. When you trace the right ventricle superiorly, it converges into a funnel shaped structure. This funnel shaped part of the right ventricle is called as infundibulum. This infundibulum will continue as pulmonary trunk, which then divides into a left pulmonary artery and a right pulmonary artery. This is right pulmonary artery behind the ascending aorta, and this is left pulmonary artery. Okay, so infundibulum continues as pulmonary trunk, which bifurcates into a left pulmonary artery and a right pulmonary artery. You can see the arch of aorta with 3 branches: brachiocephalic trunk, left common carotid, left subclavian. This is the vagus nerve crossing the arch of aorta. Now you can see this is the pulmonary trunk and its left branch. So the vagus nerve, after crossing the arch of aorta, will give an important branch called left recurrent laryngeal nerve. So you can see the inferior aspect of the arch of aorta after the left subclavian artery is connected to left branch of pulmonary trunk by means of a ligamental structure. This ligamental structure connecting the inferior aspect of arch of aorta distal to the left subclavian artery to the superior aspect of the left pulmonary artery is called as ligamentum arteriosum. This embryologically represents ductus arteriosus, which conveys deoxygenated blood from the pulmonary trunk into the aorta. From aorta through the umbilical arteries, it will be conveyed to the placenta. So close to the ligamentum arteriosum only, the left vagus nerve will give left recurrent laryngeal branch after crossing the arch of aorta anteriorly. It is crossed by the phrenic nerve. So this is left vagus giving rise to left recurrent laryngeal branch close to ligamentum arteriosum. So this ligamental structure connecting the arch of aorta with the left branch of pulmonary trunk is the ligamentum arteriosum. Close to that, the nerve that is present is left recurrent laryngeal nerve given by left vagus. And we are going to see the interior of the right ventricle. This is right atrium. So my forceps is through the tricuspid orifice from the right atrium to right ventricle, and this is through the pulmonary trunk into the right ventricle. Now this is the interior of the right ventricle. This is the inflow tract connecting the right atrium to right ventricle with the tricuspid cusps. This is the pulmonary trunk with the semilunar valve, pulmonary valve. So this is the outflow tract. This is inflow tract. This forceps is inflow tract, and this probe is outflow tract. Inflow tract is right side and posterior. Outflow tract is anterior and towards the left side. Okay, the inflow tract and the outflow tract, this is the inflow tract and this is the outflow tract. Both will be separated by a pillar like structure. This is called a supraventricular crest. This is a ventricle, above the ventricle, so it is called a supraventricular crest. This separates the inflow tract from the outflow tract. So this is the pulmonary trunk. I have opened it. You can see the pulmonary valve. These are the semilunar valves, cusps of the pulmonary valve. It has got two anterior cusps, left anterior and right anterior, and one posterior cusp. Okay. So this is the outflow tract, which will be smooth relatively, whereas the inflow tract will be rough. The rough impression of the inflow tract, these rough elevations are called as trabeculae carneae. 3 such trabeculae carneae will be bigger in size, and these are called as papillary muscle. This is one papillary muscle. On the inside you can see another papillary muscle, and these are small papillary muscles in the interventricular septum. This is left ventricle, this is right ventricle, this is the interventricular septum. You can see a small papillary muscle in the interventricular septum. This is septal papillary muscle. There is another papillary muscle in the anterior wall. This is anterior septal, anterior, and this is posterior or inferior. Okay. From the apex of the papillary muscles, you can see numerous ridges. These are the ridges, linear elevations, strands-like structures attaching to the ventricular surface of the cusps. Can you see that? This one. So this also is attaching. Strands-like cusps. And again this muscle is also attaching. So the papillary muscles are named according to the attachment in the wall. This is attached to the anterior wall. So this is anterior papillary muscle. This is attached to the interventricular septum. So it is called as septal muscle. This is attached to the posterior or inferior wall. So it is called as posterior papillary muscle. Okay. The anterior papillary muscle will be sending chordae tendineae. These are called as chordae tendineae. These linear elevations or thread-like structures attaching to the ventricular surface of cusp are called as chordae tendineae. The anterior papillary muscle will send to anterior and posterior. The posterior will be sending to posterior and septal. This is posterior cusp. This is septal cusp. So the posterior papillary muscle will be sending to posterior and septal. The septal will be sending to septal and anterior. So this is for anterior and posterior. This is for septal and posterior, and septal is for septal and anterior. So one papillary muscle will be sending chordae tendineae to two cusps. Okay. We will see the structures clearly in another specimen. This is the right ventricle. This is the right atrium. So now this is the pulmonary trunk. We have cut open and we are exposing the inflow tract. My finger you can see in the inflow tract with the cusps. This is the outflow tract with the semilunar valve. Okay. So you can see the three papillary muscles clearly in this. This is anterior papillary muscle. This is posterior or inferior papillary muscle. And this is septal papillary muscle between the interventricular septum, arising from the septum. This is anterior, this is posterior or inferior, this is septal. This is pulmonary valve. Anterior, this is posterior or inferior, this is septal papillary muscle. So from the interventricular septum, you can see a band-like structure going to the base of the anterior papillary muscle, this one. This is called as moderator band or septomarginal band. This will be containing right bundle of His. So this is septomarginal band extending from the interventricular septum to the base of the anterior papillary muscle called as septomarginal band. Anterior papillary muscle is giving chordae tendineae to anterior and posterior. Posterior is giving to posterior and septal. Septal is giving to anterior and septal. You can see the tricuspid orifice from the atrial side. You can see the three cusps: anterior cusp, posterior cusp, septal cusp. All three cusps you can see clearly. Anterior, this is anterior, this is posterior, and this is septal. Three cusps. Okay, so this is about interior of right ventricle.